So hi everyone, I'm Dave Byers, the response manager for the Department of Ecology, and I'm going to talk to you today about health and safety plans in Washington State. They're a little different than other parts of the country. Two areas really that I want to draw a distinction between, and that's the safety plan requirements during the initial response and those for the so that would be the emergency response phase or crisis phase, and the requirements for a full written health and safety plan, different set of requirements for the project phase. So we typically draw that distinction as the first 24 hours as the initial response, and then the additional requirements kick in for the full written health and safety plan in day 2 of the response. So why is Washington State different than the federal OSHA standards that apply to many other parts of the country? Well, Washington State is what's known as a state plan state. And that means we have delegated authority from OSHA. We've adopted the OSHA requirements as the floor or basement of our regulatory requirements. And in some areas, Washington State has increased the safety standards. Our safety agency is Washington State Labor and Industries, and they actually host the requirements that we all have to follow. I'll also add that Washington State is not unique in being a state plan and having delegated authority. There are 29 states in the United States that have delegated authority from OSHA. And in doing so, they have the ability to, of course, they have to adopt the federal standards as the baseline. But states that have delegated authority have the ability to increase the requirements. For example, in areas that, because of the peculiar industries or the setting that are unique to that state, they have the ability to increase those standards. And Washington State has done those for hazardous materials and oil response in areas such as the training standards, the requirements for the health and safety plans. And you can see those in two what Washington calls WACs, or Washington Administrative Codes. And those are listed on this slide. Those are WAC 296-824 for the emergency response phase, and WAC 296-843, which is for the project or cleanup phase. So day 1, during the reactive phase of the response, this is where our safety standards are essentially pre-written. We have organizational emergency response plans that we operate off of. Those are things like our SOPs. We fill out, at Ecology, we fill out job hazard assessments, which we call a hazard assessment worksheet. This is a 2-page analysis of safety hazards that we use to document and communicate those hazards amongst our team members. You might know them under the name of a job hazard analysis. And in this case, during the reactive phase, this is where an ICS 208 would actually be acceptable as that initial safety plan. But this only protects you, actually covers you in Washington State law for the first 24 hours. And then we have to do a little bit more. So after the first 24 hours, the Washington State labor and industry requirements for safety plans kick in. And we can find those in the Washington Administrative Code. It's listed there, 296-843-120. And the requirement is to develop and maintain a written site-specific health and safety plan. Now, the good folks at Labor and Industries have done us a favor. They've actually detailed point by point what they would like to see, or what they require to be a component of the written health and safety plan. What we at Ecology have done for our industry partners and the safety officer for the incident is we have a checklist that is pretty much verbatim what you'll find in the administrative code. It's just a little bit more user-friendly. So we're encouraging our industry partners to use this as a checklist when they develop their health and safety plans. When I'm in Unified Command and reviewing a health and safety plan as part of the overall incident action plan, I'll use this checklist as my own little tool, as my own checklist, before I will approve and sign a written site-specific health and safety plan. So if you want to get your plan approved by Unified Command, you're going to have each and every element of this, each and every element in law approved and in your plan before it gets signed off by Unified Command. So here's a perspective. We have to shift, and oftentimes organizations, as they join in the response, they don't make the shift, 100%. It's sometimes not a smooth transition. Your safety plan has to identify and represent every activity at the incident. It covers, the health and safety plan isn't written specific to one organization or one company, right? It's written for the spill. It's written as Unified Command's health and safety plan. It covers every organization supporting the spill response. That's all the agencies and contractors and subcontractors, volunteers, temporary hires. It covers all of those activities. The plan needs to be updated for every operational period as new activities occur, as we add those elements of the safety plan. We remove those completed activities so that it's, it doesn't have stale information in it. And we provide information for teams as they go out operationally to do their daily safety briefings. It's also important that everybody in the organization review the plan and signs the plan, acknowledging that they read and understand it. That's an important element. Here's another perspective that I encourage plans to be written from. Imagine that you just got hired on to support a big spill response, right? Your task might be beach cleaning. It might be on water skimming. Your task might be working in the command post and logistics. You're that new hire. That plan should be written for the perspective that it can identify for you what your tasks are. You find your tasks, so you can see what your task-specific hazards are. What are the action levels if there's monitoring being performed? What are signs and symptoms of exposure to the hazards? How do you protect yourself? What PPE do you use? And how do you decontaminate if you become contamination? So your safety plan should be very, very user-friendly and walk that new employee, that fresh hire, with limited training step by step to help them work in a safe manner. The tasks you need to cover, you have to cover everything that's ongoing, and tasks can include things like on-water skimming, vacuum truck recovery in a specific division. Maybe you're tending GRP boom. Are you doing air monitoring, beach cleanup, aerial observation, waste management, wildlife rescue and rehab? Those are all the tasks that need to be identified with their hazards, their action levels, what PPE and decon would be required. So is this sounding like an ICS 215? Why it should sound like a 215. That's why the safety officer attending the ICS 215 is critical, so that as new tasks get added, you can identify those and accommodate the safety plan for the next operational period, so that it stays alive and contemporaneous. Now, how do you get the HASS distribution? This is another area where we see a breakdown. You can write a plan, attach it to the IAP, and if nobody reads it, it's not doing anybody any good, right? So when I am talking to safety officers, I'm often asking them, what's your plan for getting this read and signed by everybody and getting it just distributed? What's that going to look like? Well, there are some key places that will help you do this. One key place for the safety plan is put it at the incident check-in. So when people sign in, they're new to the incident. They take the time before they start to work and they sit down with somebody who's familiar with the incident and they review the health and safety plan. So put it right next to the ICS 211P. It needs to be at staging area, because maybe labor halls, any of the areas where people are going to report to work, because not everybody's going to go to the command post usually. So we need to have copies of the safety plan, sign-in sheets, acknowledgement pages, so that when they sign it, we have a record that everybody supporting the incident had the opportunity to find themselves and their tasks in that safety plan so they can work safely. Plan updating. It is the safety officer's responsibility to update the plan for every operational period. It's important that they attend the tactics meeting each and every day. If it's a 24-hour operational period, they need to attend that tactics meeting so that the safety plan can reflect changes that happen. and that they update the plan. Another element is that we note the changes of activities on the ICS 204, the work assignments that are handed out to the operational teams. Every operational team should have a safety message written on the 204, and the safety officer needs to make sure that that gets coordinated and occurs. Safety staff. This is another area of concern often in spills and drills that we see, is that the safety officer, they certainly can't do it all by themselves. They're going to have an adequate number of safety staff out in the field at staging areas and monitoring operational activities to ensure that, PPE is being worn correctly, that decon solutions are changed out frequently, that safety plans are distributed, that safety briefings are occurring. That takes a number of staff out in the field reporting to the safety officer. Supervisors and team leads are responsible for daily safety briefings so that they identify the information, the safety information on their ICS 204s, and they find their activity in the safety plan, the tasks that they're performing, and their teams are briefed on a daily basis of the safety hazards of those responsibilities. They're responsible for documenting that those meetings are occurring on their ICS 214 unit logs, and that any changes to the plan or tasks or safety procedures are updated to their teams. Supervisors have a couple other additional responsibilities. They make sure that their teams are donning and doffing PPE correctly. They share that responsibility with the safety officers in the field. And they're also responsible for ensuring that if we're using decon solutions for decontamination, that those solutions are getting disposed when they become contaminated. All right, and I'll leave you, my final bit of information that I'll leave you with for the safety things is some trouble areas that I see in safety plans. So if you want to reference 29 CFR 1910-120, that's the OSHA HAZWOPER standard. It's great to reference that in the safety plan, but if you're in Washington State and you aren't also referencing the additional requirements in the Washington Administrative Code 296-824 and 296-843, that's a warning sign to me that you may not be current with the Washington State standards, and we may not be meeting the requirements in law for Washington State workers. Oftentimes in drills, folks will get all eager to get their work done and in early, and they'll hand me a safety plan for approval prior to the tactics meeting. And maybe in some cases, the tactics, they have done a great job of predicting all of the tasks that will happen, all the tactics that will be occurring. But in general, if I'm getting a safety plan before the tactics meeting, that's gonna be missing some of the activities that are occurring on site. So be sure you attend the safety plan. The appropriate tactics are represented. Be sure you're attending the tactics meeting, and all the activities are reflected from that meeting in your safety plan. And then I'll take a look at your plan, review it, and sign it. If occasionally I get an ICS 208, and that ICS form is called the Site Safety and Health Plan. If it comes to me under that title, I have a pretty good indication that it's not going to meet the requirements that labor and industry wants us to have in a safety plan. So that could be a potential trouble spot. Air monitoring results. So air monitoring is one of those things where even if we're getting non-detects in air monitoring, so all of our results are below action levels or non-detected, that is one of those pieces of information that is very important to communicate. That's one of those pertinent negatives that we need to get out to unified command. We need to get that to the public information officer, to the liaison officer, as well as the operational folks in the field. So if those air monitoring results aren't coming in on a regular basis to unified command, I'm going to be concerned about that. Occasionally, I will get, for a spill response, a copy of, for example, an industry facilities corporate safety plan. And that would be great if the spill were restricted to that facility, but generally spills are not, and we're responding off facility, and that needs to be reflected in a site-specific written health and safety plan. An existing corporate safety plan that's submitted, it's got good information to it. It can even be a component of our written site-specific health and safety plan developed for the spill, but it is not a substitute for that site-specific health and safety plan. And the final thing that will concern me is if I look around and I see the safety officer and maybe an assistant safety officer trying to do the whole thing for themselves during a spill response. I know that's not possible. We need additional staff out in the field doing observation, distributing information and plans, and making sure that safety practices are going well and people are operating safe and effectively. So you'll need a team of safety officers that will depend upon the size and the footprint of the spill. And there you have it. So the other question that I'll ask you and leave you with, this is a rhetorical question, because we always say that safety is our #1 priority. And my expectation is that how that shows up to me is in a well thought through and well developed site-specific health and safety plan that has really thought through the potential, all the potential tasks, all the potential hazards and risks, and that we're providing that information out to all the folks in the field to keep them safe when they're doing the spill cleanup operations. If that hasn't been done, I think it's usually apparent, and I'll question that and just really pose the question to you. Is safety always our #1 priority? Sometimes what I see, it looks like we pencil whip it. We want to check the boxes, and we're not really putting our heart and soul into making sure that everybody gets to go home safe and healthy to their families at the end of the day. And that's our goal.